Thank you for having me. Nice meeting you all. It's a pleasure to be here presenting this demo day. I will just jump into it. My name is Emilio Goldenhirsch. I'm a clinical psychologist, behavioral scientist, and also CEO of MindCo Health. We are a virtual reality behavioral health company that scales one-on-one therapy. So it makes it accessible and affordable and personalized specifically for mental health and behavioral health challenges. Now, in my personal history, I found it hard in the hard time. I lost my father due to mental health and addictions, and that was also part of these non-communicable diseases that spread out through keeping on a behavior that usually makes and produces these non-communicable diseases. So the reason why I'm sharing this is because we really try to target these behaviors that, when done chronically, develop the NCDs that you can see here, and our overall aim is to prevent suicide, as you can see today with the high rates that they are present in the world today. So what we did is we created this unique clinically designed virtual reality therapy, which is clinician-free, is drug-free, it's complementary to any of those, but basically we have the best of an app, which is consists of a CBT program, a cognitive behavioral therapy program, following CDC guidelines with most of the two-dimensional technologies available, but also virtual reality, where we empower smartphone users with this virtual reality headset. So actually anybody with a smartphone, we are available in the Quest and the standalone, but we really believe that mobile virtual reality is what it can bring accessibility and affordability to these kind of mental health therapies. And we also leverage coaching through text, powered by AI as well. So we leverage most of the integral approach that we can get into these overall frameworks, where today we have two programs available: stress management and anxiety, and smoking cessation. We also plan to cover the overall behaviors that you can see on the screen. Now, this science has over 25 years on clinical studies, but we run our own. We proved to have three better outcomes than standard of care interventions. We became the first worldwide virtual reality smoking cessation program available in the market. It has published peer-reviewed papers showing 33% efficacy rate. Just for a comparison, 6% is the quit line, or 12% is the patches. So this is three times better. And for stress management, we work with college students, we work with caregivers, with different kind of populations at different kind of levels. And why we are kind of very different today compared to other companies that work in the virtual reality space that are in the right side of the screen that you see, all of them work in clinical settings, with a one-on-one clinician following what you are doing in the virtual reality. And that is very kind of not affordable. It needs third-party management, and it's quite expensive to run it. We really focus on your smartphone. If you have a smartphone, you can have access to this. And if you have also a telehealth component, we're complementary. So we add this preventive continuum of care to the in-between sessions to everything else. We have been also proving our product market fit for the past year and a half. Today, we have 15 paying customers. We basically charge for $18 per employee per year under a subscription model, or a core risk model, also a little bit more expensive. We work in all the Americas. That includes the United States, Canada, and also from Mexico below, where we serve multinational corporations from 25,000 employees or small and medium companies. We also work with governments. In Argentina, where I am from, we're part of the state tobacco control program, officially serving 4 million people. And also we work with providers. Now, these are two examples that we have run over the past year, where we work with construction companies with an average of 45 years old. So this is not for techie people, this is for anybody, because it's a smartphone based. It's not a new technology that we have to promote. And we also have with IT companies, where we measure from the beginning to the end, the ROI, the adoption, the engagement, the utilization, and of course, the efficacy. Now, our team consists of 3 people, friends from Argentina. We are now immigrants living in the US, in San Francisco. Myself, I'm a psychologist. I have 2 good partners as well. We are a team of 7 people full-time, but also most importantly, we are led by key advisors in the market from Stanford in the VR space, from product, from data, from business and the like. And we always support being coached because again, we know our limitations in that way. Up until now, we made 2 products that are in the market, and right now we are incorporating AI technology for generative conversations to our chatbot, also to incorporate it with avatars, but most importantly, to personalize the ecological settings of the context-based learning that virtual reality provides as the unique technology that can do that. In the market itself, we focus a lot in the intersection between wellness, mobile health, virtual reality, and mental health, of course, focusing on corporate wellness, US-based, but also now increasing it to Latin America and the rest of the world, since we are multilingual today, and we plan to continue adding languages to provide operations and this benefit or this solution, as we call it, self-empowerment tools to anybody there. As of today, we have $15,000 on monthly recurring revenue. This month, we already closed 2 deals, so we jump into 20 on MRR. And our goal this year is to get to the first $1 million on annual recurring. And basically having the distribution of our contracts, 75% US and the rest in Latin America. And we plan to close our Series A, which is going to be in 2 years on $4 million annual recurring. That's why we're right now looking and closing our seed round of a $3 million round. And with terms already, with investment already from VC venture capital in the US, also from angel investors. So we are welcoming investors from anywhere in the world with any kind of help and strategic advice that we can bring and work together to solve these kind of issues that alone it cannot happen. So thank you for the opportunity to present, and I'm welcome to a conversation.